Before we begin, here's an important fact. People with diabetes are much more likely to develop heart disease than people without diabetes. High blood sugar can slowly damage blood vessels and nerves that control the heart. But many people do not notice the early warning signs until serious problems develop. The good news is that your body often gives small clues before a major heart problem happens. Learning to recognize these warning signs can help you seek medical advice early and protect your heart. Women are more likely to experience non traditional symptoms that may be incorrectly dismissed as stress, the flu, or acid reflux. Pain in the upper body, aching or discomfort in one or both arms, the back, neck, jaw, or stomach. Breathing difficulties, severe shortness of breath occurring even at rest. Digestive distress, nausea, vomiting, indigestion, or abdominal pain. Neurological signs, sudden dizziness, lightheadedness, or fainting. Systemic reactions, breaking out in a cold sweat or sudden unexplained extreme fatigue. Today we will talk about 12 warning signs that your heart may need help if you have diabetes. Some of these signs may seem harmless at first, but together they can point to heart disease that should never be ignored. Number 1, chest discomfort. Chest discomfort is one of the most common warning signs of heart disease. It may feel like pressure, tightness, squeezing, heaviness, or burning in the middle of your chest. Some people describe it as an elephant sitting on their chest. Others feel only mild discomfort that comes and goes during walking, climbing stairs, or emotional stress. But people with diabetes may not always feel severe chest pain because high blood sugar can damage the nerves that carry pain signals. This is called silent ischemia. The discomfort may spread to your shoulders, arms, neck, jaw, or back. It may last a few minutes and then disappear before returning later. If chest discomfort lasts more than a few minutes or happens with shortness of breath, sweating, or nausea, seek emergency medical care immediately. Research shows that many heart attacks in people with diabetes are silent or have only mild symptoms. That is why even small chest discomfort should always be taken seriously. Number 2, shortness of breath. Do you become breathless while walking a short distance or climbing a few stairs? But you never had this problem before. Shortness of breath may happen because your heart cannot pump enough blood to meet your body's needs. Fluid may also begin to collect in the lungs. Some people notice they cannot lie flat in bed without becoming breathless. Others wake up during the night, gasping for air. Many people think they are simply getting older or becoming less fit. But unexplained breathlessness can be an early warning sign of heart failure or blocked heart arteries. If your breathing becomes worse over days or weeks, do not ignore it. Early treatment can improve heart function and reduce complications. Number 3, unusual tiredness. Everyone feels tired sometimes, but unusual tiredness that lasts for days or weeks is different. Simple activities like shopping, cooking, or walking around the house may suddenly become difficult. Your heart may not be pumping enough oxygen, rich blood, to your muscles and organs. As a result, your body feels exhausted. Women with diabetes may notice tiredness more often than chest pain before a heart attack. Research has found that unexplained fatigue can appear weeks before a major heart event. Number 4, pain in the jaw, neck, back, shoulder, or arm. Heart pain does not always stay in the chest. It can spread to other parts of the body. Pain may appear in the left arm, both arms, shoulders, neck, jaw, or upper back. Some people think it is muscle strain or arthritis. But if it appears during activity and improves with rest, it could be related to your heart. Pain that comes together with sweating, nausea, or breathlessness needs urgent medical attention. Number 5, swollen feet, ankles, or legs. Swelling in your feet or ankles may happen after standing for a long time. But swelling that continues every day should be checked. When the heart becomes weaker, it cannot pump blood efficiently. Fluid begins to build up in the legs, ankles, and feet. You may notice your shoes feel tighter, or your socks leave deep marks on your skin. Some people also gain weight quickly because of extra fluid in the body. Persistent swelling should always be discussed with your doctor. Number 6, fast or irregular heartbeat. Sometimes your heart may race, flutter, skip beats, or pound inside your chest. This may happen during exercise or excitement, but it should settle down once you rest. If your heartbeat remains fast, irregular, or happens without a clear reason, it may be caused by an abnormal heart rhythm. People with diabetes have a higher risk of developing atrial fibrillation and other rhythm problems. These conditions increase the risk of stroke and heart failure if left untreated. While we are in the middle of the video, if you think this video is useful, click the like button and subscribe to my channel. It is a simple help to encourage me to make more videos. Number 7, feeling dizzy or faint. Feeling lightheaded once in a while can happen for many reasons. But repeated dizziness, fainting, or nearly fainting may mean your heart is not pumping enough blood to your brain. An abnormal heartbeat, blocked arteries, or heart valve disease can all reduce blood flow. If dizziness happens together with chest discomfort or shortness of breath, seek emergency medical care immediately. Number 8, cold sweats and nausea. Breaking out in a cold sweat without exercise or hot weather should never be ignored. Some people also feel sick to their stomach, vomit, or lose their appetite. These symptoms can happen during a heart attack, especially in people with diabetes. Because diabetes may reduce pain sensation, sweating and nausea may be more noticeable than chest pain. Research shows that many people delay seeking treatment because they mistake these symptoms for indigestion or food poisoning. Number 9, trouble exercising. Have you noticed that you cannot walk as far as you could a few months ago? Maybe climbing stairs leaves you exhausted much sooner than before. But if your exercise ability keeps getting worse, your heart may not be supplying enough oxygen to your muscles. This can be an early warning sign of coronary artery disease. Keeping track of changes in your daily activities can help you notice heart problems earlier. Number 10, poor sleep because of breathing problems. Some people wake up several times during the night because they cannot breathe comfortably. Others need 2 or 3 pillows to sleep without becoming short of breath. This can happen when fluid builds up in the lungs because the heart is becoming weaker. But many people blame poor sleep on stress or aging and never mention it to their doctor. If breathing problems disturb your sleep regularly, arrange a medical checkup. Number 11, erectile dysfunction in men. Many people do not realize that erection problems can be an early warning sign of heart disease. The same blood vessel damage that affects the heart can also reduce blood flow to other parts of the body. Men with diabetes often develop erectile dysfunction years before heart disease becomes obvious. But many men feel embarrassed and never discuss it with their doctor. Research suggests that erectile dysfunction may appear several years before a heart attack in some men. Number 12, no symptoms at all. This may sound surprising, but one of the biggest dangers of diabetes is having no warning signs. Diabetes can damage the nerves that normally cause chest pain during a heart attack. This means a person may continue normal activities while serious heart damage is happening. Some people only notice unusual tiredness, mild breathlessness, sweating, or feeling generally unwell. But silent heart disease can be just as dangerous as painful heart disease. That is why regular medical checkups are so important for people living with diabetes. Your doctor may recommend blood pressure checks, cholesterol tests, kidney function tests, blood sugar monitoring, electrocardiograms, stress testing, or heart imaging based on your individual risk. The good news is that there are many ways to lower your risk of heart disease. Keeping your blood sugar in your target range helps protect your blood vessels over time. Controlling blood pressure is just as important, because high blood pressure makes the heart work much harder. Healthy cholesterol levels help reduce the buildup of plaque inside your arteries. Regular physical activity strengthens your heart and improves blood circulation. Eating more vegetables, whole grains, healthy fats, lean protein, beans, nuts, and seeds supports heart health. But reducing sugary drinks, processed foods, excess salt, and unhealthy fats is also very important. If you smoke, stopping smoking is one of the best gifts you can give your heart. Taking your prescribed medicines regularly also helps reduce the risk of heart attack and stroke. Research continues to show that managing blood sugar, blood pressure, cholesterol, body weight, and physical activity together provides much greater protection than focusing on only one area. Never ignore changes in how your body feels, even if the symptoms seem small. Your heart often gives quiet warning signs long before a major emergency happens. Listening to those signals and getting medical advice early can save heart muscle, improve your quality of life, and may even save your life.